A very good morning everyone, this is group MO3 here and today we'll be showing a video presentation about male physicians treating female patients where we'll be discussing their issues, controversies and gynecology. So this is all our group members, there are 12 members in our group. Why patients prefer female gynecologists? Point number 1, personal comfort. Personal comfort is the biggest reason females want to be seen by the same gender doctor. The matter of personal comfort comes into play in intimate settings where either an internal examination is warranted or when personal and sensitive health issues are disclosed, which happens on a regular basis at obstetric and gynecology. Point number 2, female gynecologists understand the problem better. Significant proportion of female patients feels that the female gynecologists are able to comprehend their health issues and situation better since they are having similar anatomy and physiology. Patients also claim that female gynecologists are good at acknowledging their emotions and making sure both their physical and psychosocial needs are met. Being able to understand and empathize with patients makes it more likely for the patients to open up about their complaints. Point number 3, supportive. For example, among gynecologists, women were found to have a more supportive attitude about abortion and birth control than men. Female gynecologists also tend to make more referrals to specialists for medical conditions, which can be beneficial in ensuring the female patient experiences the best care possible from the most knowledgeable doctor.
So for the second part, the male medical student problem, clinicians have consciously and unconsciously come to realize that less negotiation for the consent to involve a student in a pelvic examination will be needed if the student is a female. A study from the Kingston General Hospital showed that 72.8% of clinic patients reported they would accept on intimate examination by a medical student of either gender compared with only 32.1% of high school students. In addition, 22.2% of clinic patients indicated they would only accept a female student, in a comparison to 55.3% of high school students who would do the same.
As for the third part, some of the controversy in this area of discussion include the dwindling ranks of male OB-GYNs. The controversy is that male gynecologists have been declining significantly over the past 5 decades, and the medical community fear the trend could have negative implications for the field, while others say the concern carries a sexist undertone and women can do just fine without male gynecology doctors. Continue. Currently, women account for 59% of OB-GYNs. In comparison, men last year comprised just 17% of OB-GYNs residents. Overall, by 2025, women are expected to make up to 2/3 of OB-GYNs. Some stakeholders are concerned men could eventually become excluded from the specialty entirely, which they say is both unfair and has ramifications for care, and the gender imbalance could hurt the quality of care. So for the number 4, last but not least, the notion that women prefer a female OB-GYN is exaggerated. So this misperception has been reinforced over the years by anti-male obstetrician gynecologist biases in articles and advertisements published in popular women's magazines. Unfortunately, men in particular appear to be influenced by what they perceive as patient desire and the trends of the profession. A review of 23 studies found about 41% of OB-GYN patients have no preference when it comes to their provider's gender, while 8% said they prefer a man. And several female OB-GYNs have said a focus on gender reduces women's skills to biology and does not account for gender non-conforming patients. So others said, women want a good doctor regardless of gender. So that's all for now. Thank you everyone for watching.